How many of you, by a show of hands, would agree that we have opportunities to improve the way healthcare is delivered? Okay, there's the easy question. How many of you would say that you've had or currently have percolating somewhere in your brain an idea about how to make your workplace better, your department, your role? And it's really easy for organizations to say, we are excellent. It's a different version of Lake Wobegon, where I think 90% of hospitals are in the top 10% somehow if you ask them. She pointed at their suggestion box and she said, that box is where good ideas go to die. Is that the box itself is a problem, because if we want transparent, open processes, the box is the opposite of that. It's opaque, it's usually opaque, but they're locked, right? And I like to ask people, well, think about this for a minute. Why is it go try to buy a suggestion box online. Look online wherever you might buy this and think, well, why do they just assume it must have a lock? I like to ask, are we afraid that people are coming in at night from a competing health system and harvesting our employees' brilliant ideas? Or, well, no. The Kaizen word from Japanese has two parts, meaning basically change and good. Kaizen, or change for the better. People usually know the word Zen. We think calm, good. There was an ED director that I was coaching and following very early in the Kaizen process. And he was going up to staff members, well-intended, with a smile. He was trying to do the right thing, and he was trying to engage people, and he would ask literally, "Hi, are you busy?" 9 times out of 10, the answer as a reflex was what? Yes, and keep walking. Are you busy? Yes. Because maybe the environment is one where people are scared to admit they're not busy. That's a very loaded question. He didn't mean it that way, but that's what was happening. Kaizen is pretty well proven to improve employee engagement. We can start connecting dots here. Happy employees, engaged employees, I think is a noble goal. But we know in healthcare that also leads to what? To patient satisfaction, to better quality and outcomes. Correlation, causation, I think the causation is reasonable. That can directly or indirectly lead to patient volume. All of that in different ways can lead to better financial results. So it's kind of a catch-22. Sometimes by focusing less on the financial results and engaging people in this process, we get better financial results than we would have otherwise. That's one of the things that's still fascinating to me, I think, about Kaizen.
So let's all give Mark a warm hand for a great job.
Thanks. Thank you, Jack.